Let's talk a little bit about cholesterol and the risk. Cholesterol actually is a lipid, it is a sterol, it is let's say a fat that is in our bodies. And there are some things that you might eat that may predispose you to having high cholesterol. You might be within your ideal weight, but your cholesterol is high. You might also be underweight and your cholesterol is high. You might be obese and your cholesterol is high, or the vice versa. You might be obese and your cholesterol is okay, you know. So what causes this cholesterol to be, you know, high? What do we eat that makes this cholesterol to you know, rise? And what are the tests? There's a test that we call lipid profile that you can do in a hospital, and it will show you the components of your total cholesterol. We have what we call the triglyceride levels and the high density lipoprotein, which we call the good cholesterol, and the low density lipoprotein, which is now the bad cholesterol. Where do you get this? There are foods that are high in the low density lipoprotein, which is the bad cholesterol, such as people who consume a lot of alcohol, meats, the red meats, such, and the saturated fatty acids. So whole milk, you get the saturated, say in mostly animal product that is whole, like the whole milk. And I've talked about the alcohol. And how can you get the high density lipoprotein, which is now the good cholesterol? When you want to eat fats, it is good to consider eating seeds. Seeds like flax seeds, chia seeds. You may want to take pumpkin seeds, the nuts. Actually, the nuts that are very high in the high density lipoprotein are the walnuts and the almonds. You might want to consider integrating this into your diet, like your day-to-day, you know, eating. Pumpkin seeds, you can actually get them in the supermarkets. All these seeds, you can get them even in the markets. The pumpkin seeds, you can actually buy the whole pumpkin and fry the seeds, dry them, and then you can fry and eat them. The flax seeds, you can actually dry them in the pan and grind them using a blender and use them in, say, porridge, even for the young children. But above all, we might want to consider all these life changes, which might include the, you know, eating healthy and also being physically active, so that you may not be at risk of having this high cholesterol, which may lead to risk factors that we've talked about there, the cardiac diseases, because, you know, the bad cholesterol, the LDL, deposits itself in the lumen, in the walls of your blood vessels. And so with time, it deposits itself, and with time it clogs the vessels, and so that is where now the cardiac issues come in. So I would want to urge all of us to try and maintain a healthy weight, because it is generally overall for your, you know, important for your good health overall.